The exercises I would prescribe to my patient would be simple flexion, extension, and abduction range of motion exercises. So just having the patient work on going into flexion, extension, and then abduction. And the goal of this is just to first increase that range of motion. And I would prescribe this once he has been in his splint and the pain and inflammation has gone down, so he is able to go through those range of motions without a lot of symptomatic pain and discomfort. And then once he's been able to progress through all those range of motions, the next one I would also add in would be opposition. So I would have my patient start with just tapping pad to pad, starting with the closest finger and working out towards the pinky, again, as tolerable to the patient, making sure that they're not progressing too quickly because we don't want that inflammation to exacerbate through that. And then once they have completed full range of motions within that flexion, extension, and abduction, then I would go into strengthening. So this you can use a rubber band, or we have a nice ponytail here. So to go into flexion, I would just have the rubber band around the base of the thumb here, and then holding it here and on a stable surface, and gradually going into that flexion, just straight down, range of motion. And then for extension, I would just reverse it, again on a stable surface, and having the patient practice going up. And then for abduction, I would just hold it on this side of the hand and then practice just going straight inward. And this would help with strengthening through that movement. And then you can also work on the opposition movement, which also is symptomatic for the patient and shows to be decreased in range of motion as well. So with this one, having the patient come across when they had full range of motion, and then now just adding resistance to that by pulling back. So then having the patient just bring their thumb straight across with a little resistance. And all those will help with strengthening of that joint within the CMC. And those are what I would prescribe my patient to begin with.